Next topic is plant products. So in plant products, what will happen means the drugs which are extracted from the plant products, that is natural products. And these natural products have been used in the synthesis of the chemical constituents chemical constituents. See here, the plant products have been used extensively in the treatment of the malignant disease. Means in olden days, the plant products which are means the plant products or the natural products which are used in the treatment in the olden days since thousands of years. But the studies of the Dustin in 1938 on the cytotoxicity of the colchicine heralded at the start of the search of the natural anti-neoplastic agent. Means from the natural products, the synthetic or the semi-synthetic products have been isolated. See, today the large number of the chemical constituents which has been isolated from the naturally occurring products in order to used in the treatment of the anti-cancer. Means it has the anti-cancer agent. Means the plant in olden days, the plant products are the main source for any of the diseases. Then year passed by, the chemical constant have been produced that is obtained from the natural products, and these chemical products have been used in the treatment of the cancer. And there are it is divided into the 4 categories. First one is Vinca alkaloids, taxines, Epipodophyllotoxins, and camptothecin analogs. So these are the 4 categories which comes under the plant products, that are Vinca alkaloids, taxines, Epipodophyllotoxins, camptothecin analogs. Next, in Vinca alkaloids, first example is Vincristine sulfate. So this is the structure of the Vincristine sulfate. If you see here IUPAC name, 11 acetyl oxy, 12 ethyl, 4 17 ethyl, 17 hydroxy, 13 methoxycarbonyl, 11 diazotetracyclononadecane, 8 formal, 10 hydroxy, 5 methoxy, 8 16 pentacyclonadecane, 10 carboxylate sulfuric acid. So if you see in the structure, in 11th position acetyl oxy is present. See here in 11th position acetyl oxy, and in 12th position ethyl, and in the 4th position this group is attached, that is 17 ethyl, 17 hydroxy, 13 methoxycarbonyl, 11 diazocyclononadecane, and here 8 formal, 10 hydroxy, 5 methoxy, 8 16 aza means nitrogen. In 8th position and the 6th position we have the nitrogen. 8 aza tetracyclo means 4, pentacyclo means 5 rings, 1 2 3 4 5. So pentacyclononadeca, 10 carboxylate, and this is sulfuric acid. I will explain it again. 11 acetyl oxy. Here in 11th position acetyl oxy is present. In 12th position ethyl. In 4th position this group is attached, that is 17 ethyl, 17 hydroxy, 13 methoxycarbonyl, 11 diazotetracyclononadecane, 8 formal, 10 hydroxy, 8 16 diaza, pentacyclo, 1 2 3 4 pentacyclononadecane, and 10 carboxylate sulfuric acid. This is the structure and IUPAC name of the Vincristine sulfate. Next properties are it appears as the white crystalline solid and it is easily soluble in water. Next, pharmacokinetics are it is not well absorbed through the oral route. Because of its large molecular size, it is given through the intravenous infusion. So it is metabolized in the liver and excreted through bile and urine. Means it is not absorbed through the oral route of administration. So we should avoid the oral route of administration because of the large molecular size. So it should be administered through the intravenous fusion route of administration, and it is metabolized in the liver and excreted in bile and urine. Adverse drug reactions are nausea, vomiting, weight loss, diarrhea, mouth sores, dizziness, or headache may occur. This medication also may cause the constipation, temporary hair loss, alopecia, and neurotoxicity. Next uses, it is used in the treatment of the leukemia, Hodgkin's disease, non-Hodgkin lymphoma, neuroblastoma, Ewing's sarcoma, Wilms tumors, multiple myeloma, and chronic leukemia, thyroid cancer, and brain tumor. So these all types of the tumors, this drug is used, that is vincristine sulfate. And it is also used to treat the blood disorders. And the dose should be 1.5 to 2 mg intravenous route, that should be taken weekly. Next, vinblastine sulfate, and this is the structure. And here IUPAC name is 11 acetyloxy 12 ethyl and 4 17 ethyl 17 hydroxy 13 methoxycarbonyl 11 diazotetracyclononadecane 8 methyl 10 hydroxy 5 methoxy 8 16 diazopentacyclonodeca 10 carboxylate sulfuric acid. So if you see here, in the 11th position acetyloxy group, in the 12th position ethyl, and for the 4th position this group is attached, that is 17 ethyl, 17 hydroxy, 13 methoxycarbonyl, 11 diazotetracyclononadecane, 8 methyl, and 10 hydroxy, 5 methoxy, 8 16 diazap, and how many ring structures are there? 5. So pentacyclodeca, 10th position carboxylate sulfuric acid. I will explain it again. 11 acetyloxy, 12 ethyl, 4 17 ethyl, 17 hydroxy, 13 methyloxycarbonyl, 11 diazotetracyclononadecane, and 8 methyl, 10 hydroxy, 5 methoxy, 8 16 diazopentacyclodecane, 10 carboxylate sulfuric acid. This is the structure and IUPAC name of vinblastine. If we observe the structure of the vincristine and the vinblastine, the structure is almost same. But if we see here, in the R position, for the vinblastine sulfate, the methyl group is there. For the vincristine, here the formyl group will be present. That is only the difference between the vinblastine and the vincristine. So in vinblastine, in the 8th position the methyl group is there, but in vincristine, in the 8th position the formyl group will be present. So next properties, it is the needle in shape and insoluble in water, petroleum ether, soluble in alcohol, acetone, ethyl acetate, and chloroform. Next, pharmacokinetics. It is not well absorbed orally. means because of its large molecular size. So this drug should be also taken through the intravenous route because of this larger molecular size. It is not orally well absorbed and it is metabolized in the liver and excreted through urine. And adverse drug reactions are redness at the site of injection because this drug is taken through the intravenous route. So at which side we are taking the injection, at that side we will feel the pain, fever, chills, vomitings, loss of appetite means loss of hungry, weight loss, temporary hair loss, constipation and tiredness. And uses, it is used to treat the various types of the cancer, and it works by slowing or stop completely, it will stop the growth of the cancer cells. And the dose should be 0.1 to 0.15 mg per kg, means based upon the human body weight, should be taken 3 doses weekly by intravenous route. So these are the 2 drugs which comes under the Vinca alkaloids, that is Vinblastine and Vincristine. Next, Epipodophylotoxins. In this, Etoposide drug will become. So this is the structure of Etoposide, and IUPAC name is 7,8 dihydroxy 2-methyl hexa dihydropyrano 1,3 dioxin 6-vial oxy 10 4-hydroxy 3,5 dimethoxyphenyl 1,6,8 trioxa tetracyclohexadecane 12 ohm. So if you see in the structure, in 7th position, 8th position, hydroxy groups are present. How many are there? 2. So dihydroxy. So 7,8 dihydroxy. In 2nd position, methyl, 2-methyl hexa hydropyrano, and in 1st position and the 3rd position oxygens are there. So dioxin, and 6th position, this is attached to the another ring. So 6-vial oxy, and here 10. So actually this structure is the tetracyclohexadene. So for this tetracyclohexadene at the 10th position, this phenyl group is attached. So in the phenyl, if we see that the 4th position is hydroxy, 3rd and 5th position is methoxy. So how many are there? 2. So it is dimethoxy, 3,5 dimethoxy, and this is the phenyl which is attached to the 10th position. And here if you see here, in 1, 6th position, 8th position, oxygens are there. That is 3 oxygens. So 1, 6, 8 trioxa. How many ring structures are there? 1, 2, 3. So tetracyclohexadeca 12 ohm, means here double bond oxygen is there. So I will explain it again. 7,8 dihydroxy 2-methyl hexahydropyrano 1,3 dioxin 6-vial oxy 10 4-hydroxy 3,5 dimethoxyphenyl 1,6,8 trioxa tetrahexadeca 12 ohm. So this is the IUPAC and structure of the etoposide. Next properties are, it is a solid crystals and very soluble in methanol and chloroform, slightly soluble in ethanol and sparingly soluble in water. So it is the oral route of administration, and it is also administered through intravenous, means it is administered through oral route and the intravenous route of administration, and it is metabolized in the liver and excreted through the urine in unchanged form, and it has a poor entry in the CSF, means cerebrospinal fluid means it has the pour entry is poured into the cerebrospinal fluid, means it is oral and the intravenous route of administration, and it is metabolized in the liver, excreted through urine in unchanged form. Adverse drug reactions are nausea, vomitings, dizziness, loss of appetite, diarrhea, weakness, pain or redness at the site of injection. Means if we take through the intravenous route, means at which side we are taking the injection, at that side we may feel the pain or the redness. Tiredness, temporary hair loss, changes in the taste, and pain or the sores in the mouth, means if it taken through the oral route as a tablet or the capsule, means we can see the pain or the sores in the mouth and the throat. And after the completion of the brushing, should avoid the mouthwashes that can contain the alcohol, so which contains the alcohol or the baking soda or the salt, it should be avoided while using this drug, because of the it may cause the muscle contraction. Next uses, it is used in the treat the testicular cancer and certain forms of the lung cancer, and it works by slowing the growth of the cancer cell. Next dose, it should take in 50 to 100 mg per day for 5 days through IV route or the oral route. Whatever the route, it may be the oral route or the intravenous route, we should take 50 to 100 mg per day. Next, so this is the drug that is Etoposide, which comes under the Epipodophyllotoxins. So these are the three drugs like Vinblastine, Vincristine, Etoposides. These are the three drugs which comes under the plant products, that is natural products. Next, other cytotoxic drugs. In this, Cisplatin, and this is the structure of the Cisplatin, and IUPAC name is cis dichlorodiamine platinum. So if we see here, cis means the atoms, the same atoms are present on the same side. Like see here like this, that chlorine and the chlorine is present on the same side, means it is the cis. Trans means if the chlorine is present this side and if the chlorine is present opposite side, means that is the trans. So here it is present on the same side, so it is called cis. How many chlorine atoms are there? Di. So 6 dichloro and 2 amine, diamine, in middle platinum is there, so platinum. So it is named as cis dichloro diamine platinum. I will explain it again. In cis positions, the chlorine and the amine groups are present. So dichloro diamine, which are attached to the platinum at the middle. So it is named as cis dichloro diamine platinum. And properties are, it is white to yellow color powder, and it is soluble in the organic solvents such as dimethyl formamide, is also known as DMF, and DMSO means dimethyl sulfoxide, and it is also soluble in water, means it is soluble in organic solvents, and also it is soluble in water. Next, pharmacokinetics, it is the intravenous route of administration, and it is metabolized in the liver, and it is excreted through the urine. So although small amount of the platinum is present in the bile, large intestine after the administration of the cisplatin, and fecal excretion of the platinum appears to be insignificant. Next, adverse drug reactions are nausea, vomiting, diarrhea, temporary hair loss, loss in ability to taste the food, means the person whatever he eat the food, that he can't able to identify the taste. Hiccups, dry mouth, dark urine, decreased sweating, dry skin, and other signs of dehydration. Next, therapeutic uses, it is used to treat the various types of the cancer that include testicular cancer, ovarian cancer, cervical cancer, breast cancer, bladder cancer, head and neck cancer, esophageal cancer, lung cancer, brain tumors, and neuroblastoma. So these are the types of the cancer. For these types of the cancer, this drug has been used, that is cisplatin drug. and which is given by the injection into the vein. So it is drug is taken through the intravenous route of administration, and the dose is 20 mg per day for first week, and daily dose should be maintained 4 to 6 mg per kg per day. So based upon the body weight, the dose should be maintained. Next, miscellaneous drug. This Mitotane, and this is the structure, and this is the IUPAC name. IUPAC name is 1,1 dichloro 2,2-chlorophenyl 2,4-chlorophenyl ethane. So if you see here structure 1, 2. So in first position 2 chlorine atoms are there. So 1,1 dichloro. See here in first position 2 chlorine atoms are there. So 1,1. 2 chlorine atoms means di. So it is the dichloro. And next here in second position 1, 2. So in the second position these two phenyl groups are present. That is if you see this phenyl structure, in the second position the chlorine atom is there. So that is 2-chlorophenyl. So here in 2-chlorophenyl, and here in fourth position the chlorine atom is there. So it is 4-chlorophenyl, commonly known as 1,1 dichloro 2 and 2-chlorophenyl 2,4-chlorophenyl ethane. I will explain it again. 1,1 dichloro. In the second position, here in the second position, the 2-chlorophenyl and 4-chlorophenyl is attached. Here 1, 2. So in second position, the chlorophenyl group is present. So chlorine group is present. So it is 2-chlorophenyl. And in fourth position, the chlorine atom is present. So it is 4-chlorophenyl. And this is the ethane. So it named as ethane. So 1,1 dichloro 2,2-chlorophenyl 2,4-chlorophenyl ethane. So this is the structure and IUPAC name of the Mitotane. Next, properties. It is a colorless powder soluble in ethanol, isooctane carbon tetrachloride. So it is soluble in ethanol, carbon tetrachloride, isooctane. And next, it is pharmacokinetics. It is the oral route of administration, and it is metabolized in the liver, and it is excreted through the bile. Next, adverse drug reactions are dizziness, drowsiness, a spinning sensation, vertigo, and tiredness, nausea, vomiting, diarrhea, loss of appetite, headache, unusual weakness, depression or skin rashes, flushing, fast heartbeat, tremors, breast enlargement in the males, unwanted hair growth in the females, mental or the mood changes, speech problems means the person can't able to speak properly, numbness or tingling of the hands or feet, unsteadiness, pink urine, vision problems, unusual or rapid weight loss, change in the skin color and or thickness, easy bleeding or brushing. Next, uses. It is used in the treatment of the various cancers like adrenal gland, adrenal cortical carcinoma. So it is used in the treatment of the cancer of adrenal gland, and the dose should be 2 grams to 6 grams orally in 3 or 4 divided doses per day. So these are the anti-neoplastic or anti-cancer agent drugs, and this is the references books which has to be followed for the anti-neoplastic agent. By this, the anti-neoplastic agent has been completed.